To get vaccines into arms is just one part of this battle, this ongoing battle. The other is finding out who has the virus and who needs to stay home. Ontario's Chief Medical Officer of Health says limited resources means the province will now have to prioritize case and contact tracing for the most vulnerable people and will need to use rapid tests to keep essential healthcare workers working. Dr. Kieran Moore painted a pretty grim picture of the next coming days and weeks as the Omicron variant takes a hold of this province, saying he expects hospitalizations to rise and imploring people to get their booster shot ASAP. And he did not mention any new restrictions, however. Matt Ingram has more.
Expect longer wait times for testing in some parts of the province.
Increasing demand is making it more challenging to access timely testing.
Expect hospitalizations, which are up 9% this week, and ICU admissions, which are stable for the moment, to increase.
That in the coming days and weeks, we will start to see a greater impact of Omicron on hospitalizations and our intensive care unit.
And expect resources to be prioritized.
To ensure our most vulnerable are protected and that health care in essential settings remain open and functioning effectively.
At his latest COVID-19 briefing, Ontario's Chief Medical Officer, Dr. Kieran Moore, says the limited number of rapid tests must be used to keep asymptomatic healthcare workers exposed to the virus on the job, saying instead of the standard approach of asking them to isolate, they will be asked to keep coming to work and will be tested every day for 10 days.
We're absolutely anticipating that we'd have a high absenteeism rate potentially if we kept on with that standard approach.
And with the high demand for PCR testing from the general public, he says to expect an announcement soon on how those PCR tests will be prioritized. Moore also says the limited human resources of the regional public health units to provide case management and contact tracing will have to be directed towards the most vulnerable settings.
The shelters, the long-term care facilities, the retirement homes, where we must learn from the last 20 months.
Moore is also asking household contacts of positive cases to stay home and isolate regardless of vaccination status, and is reminding everyone to get their booster shot as soon as possible. Matt Ingram, CHCH News.